Major General Professor Hany Hafez Lutfi, Professor of Radiology Armed Forces, Head of Radiology Departments, Maadi Armed Forces Hospital, Assistant Secretary General, Egyptian Society of Radiology, and member of the Steering Committee of the IAEA for Radiation. Dr. Hany will give us a talk about patient care in radiology department.
Thanks, Chair, for the introduction. It's a pleasure to share in that great conference. Thanks for the whole conference committee, especially Dr. Dina, the moderator of this session. In any health community, the patient is the most important member. The effort of every member of the team should be directed to the safety and well-being of the patient. We should be focused on our patients. We need to vigorously promote ourselves in order to attract referrals from primary care physicians and those patients who are self-referred. We must change the perception that we are consultants and only demonstrate our ability to provide complete patient care. That's the flow of the patients, and we should be caring of them in each step. Minimize delays, increase communication, create a welcoming environment of caring, responsive peer. The patient's have the right to be safe, high quality medical care without discrimination. You have the right to know the name and role of your care provider, doctor, nurse, radiographer. You have the right to request that a family member, friend, or a physician be notified that you are under the care of the facility. You have the right to provide confidential treatments, communication, and medical records to the extent permitted by law. Regarding patient responsibility or family member, provide accurate and complete information, report any conditions that puts you at risk, promote your own safety by becoming an active, involved, and informed member of your healthcare team. One-step registration and scheduling to include web-enabled is the future of radiology. Patient-accessible web page. All patients requiring radiology service will be able to schedule their appointments or have their exam completed and their report available to their physician and within the same working day. You should be good communication between radiologist, radiographer, and patient. Radiology should be justified. No diagnostic exposure is justified without a valid clinical induction. After justification, we come to optimization of the technique, diagnostic quality of radiographic image, reduce exposure, the choice of radiological technical factors. Needing special care in the radiology department, first accidental victims, then head injuries, special injuries, extreme fractures, multiple injuries, and extra. Radiographer should read the patient prescription before doing the radiograph to be sure that requested examination and consult radiologists in some cases. When making an appointment, please tell the scheduler if you have any allergies. When you come for your exam, please be sure to bring a list of your current medications. The patient has the right to know the steps of the examination and how long it will take and other complications if there is complication in intervention radiology procedures. You should enhance visibility. We should be visible to the patients not in the background. Get out in front. Post photos of radiologists in hospital, include radiologist signature, give patient your card, call your patient, and can take you from the back room to the front room. Patients are the entire reason for we are here. So we speak the language of our patients. Also, we should primarily responsible for many malpractice claims when there is our professional responsibility to be communicate well. Our satisfied patients will be our radiology ambassadors. Patients should know the role of radiographer regarding creating the best images, and the role of radiologist, and know his career and employment by the provider, organization, or member of a contracted teleradiology. Patients should be informed by advantage of intervention radiology, as decreasing risk and pain and recovery time of significantly reduced in many cases. Many procedures can be performed without an overnight stay in the hospital or general anesthesia. Consent form usually getting in intervention and contrast media procedures, but I prefer in some cases to be in all examinations, so patient not be afraid from intervention and contrast media examination. The consent form of practice differs completely from the consent form of research. You should, if you will put patient in a research, you should make another informed consent. You can't manage what you can't measure. Reduce bottlenecks. Apply same rigor to add or and work in patients. Patients deserve to know why they are waiting. Improve exam start time. Avoid undue delay. Take to the patient in a friendly way. Talk to the patient in a friendly way. Call him by his name and introduce yourself and explain in a simple language what is going to happen. That's our role and the role of the organization. A growing blockage of appointments has begun to impact timely access to services. There is multiple factors showing the system down and adversely impacting patients throughout. After emergency patients, we should be careful for pediatric patients, geriatric patients, fasting patients, especially in diabetes, and once the examination is finished, he should take his meal. Also, premature babies nursed in incubator should be examined quickly for a brief period of time, and also to guard against hypothermia and infection, which are critical in that cases. During the examination, if patient has to be undressed for examination, this should be not in front of everyone, should be in closed doors and kept closed to ensure the patient's privacy. Careful transfer of the patient from the wheelchair or stretcher to the X-ray table, and please leave that to other people who are working in that field. Review the films before allowing the patient to leave the examination. It is a very bad thing that we resend the patient to repeat examination or a part of the examination. The responsibility of the MR Safety Committee to ensure that the MR safety guidelines are established and maintained on a current basis. That's some examples. That's the MR in pregnancy is not a problem. No encouraged problems in that case. Ultrasound is also no problem in ultrasound. That's protection in the MR facility. We show some examples of patient complaints and the response of that by our team. When you squeeze the ball, you should stop or pause the scan. Screaming from the subject, another more step emergent stop for the system. Someone pinned to the magnet is a great problem. Quench the magnet. Fire from magnet is only emergency power on the electricity. Post-examination, avoid undue delays, special positioning, visit the patient. A report about the special procedures, the patient or one who sent by receipt is the only one allowed to receive the report. This ensures privacy and secure certain informations. Discount is not really a discount, it is just advertising, while many engage in this practice. Occasionally, it is offered for poor people and should not be advertised. The radiographer is a proper technique and procedures, thus a correct diagnosis and treatment. Thank you.
Thank you very much, Dr. Hany, for this comprehensive lecture. Do you have any questions?